Hello, everybody. Thank you so much for joining us today for the spotlight on the dental hygiene major here at Massachusetts College of Pharmacy and Health Sciences. My name is Thomas Egan. I am one of the assistant directors of admission at the admission office here at MCPHS Boston. And joining me today are two panelists, a professor and current student in the dental hygiene program. So I'm going to let them introduce themselves to you. So take it away, Diane.
Thanks, Tom. It's a pleasure to be here with you. I'm Diane Smallage. I am currently the interim dean of the Forsyth School of Dental Hygiene, and I've been here as a professor since 2008. And I've been in the dental hygiene field for over 40 years, which is hard for me to believe. And so, welcome, everyone.
Hi, everyone. My name is Cindy Lee, and I am a third-year pre-dental dental hygiene student, minoring in public health here at MCPHS University. I was born and raised in Boston, and then I grew up in Foxborough for a little bit.
All right. Well, thank you, Diane and Cindy. And I can't wait to hear the answers to the questions we have. So I am going to start with you, Diane. So can you describe the strengths of the dental hygiene program that makes it the best choice for students?
Yes, I think that there's a number of things that makes our program stand out. One is, of course, that it's a bachelor's degree program, and a lot of people don't realize that there are still many associate degree programs in the country. However, ours is a bachelor's degree program, and I think that that allows students to leave us with a broader scope and a better lens that they look through their work with. You take electives, you do some research. There's things that stand out in a bachelor's degree program that I think better equips you for when you graduate. Of course, being in Boston, it's a wonderful place to be going to dental hygiene school because we're right in the heart of the health professions community. We have Boston Children's Hospital down the street. We actually have an affiliation we send students to when we're not in a pandemic. And also we have Dana-Farber. We have a number of public health affiliations where we send students out and they have an opportunity to be in the city and in the surrounding communities offering care to underserved populations. So it's a wonderful location. Of course, we are the longest continuously running dental hygiene program in the country, and we're very proud of that. And there's a reason we've been around for so long and that we're still running strong, and that's because it's a high quality program.
Excellent. Thank you, Diane. So over to you, Cindy. So pretty simple one right out of the gate. Why did you choose MCPHS?
Hi again. So the reason why I chose MCPHS was pretty much the reason why the program that Professor Smallage was just explaining. I chose it because it was a bachelor's, like I would graduate with a bachelor's program, the bachelor's degree, sorry, in dental hygiene, which was really helpful as a pre-dental dental hygiene student because it would allow me to fulfill all of the prerequisites that I need for dental school or like any other potential program that I may need for a graduate program while getting a bachelor's degree in dental hygiene. Another reason why I chose MCPHS was because we have a clinic right on campus, which gives us the opportunity to work with patients early on so that we're just not tossed into the field, not knowing what we're doing. We get a lot of time working with our professors, learning how to use the instruments, learning how to talk and communicate with patients and also other professionals as well.
Excellent. Thank you, Cindy. And going back to you, Diane. So what do you enjoy most about teaching at MCPHS Boston?
Well, first, I think the diversity of our students, the diversity of our programs, and I appreciate that Cindy talked about her her particular track. She's in pre-dental, and we have more than one track. We have students that come in with 2 years of general education coursework to do because they're going to do all the prereqs, as Cindy has done, all the prerequisite courses to get into dental school, and then they step into the professional phase in the dental hygiene. So we have that track available. We also have that track where it's an accelerated dental hygiene program where you get your bachelor's degree in 3 years. And we also have a graduate program and another satellite campus in Worcester where students are in what we call a fast track program. And that's really designed for students that have already had some college experience and then step into the professional phase. But about your question about what I like most about teaching. And I think I've always found it's really a privilege to teach the next generation of dental hygiene students. And when I first got into teaching uh, over 20 years ago, I was a little arrogant and I thought, oh, after 20 years of experience, I'm going to impart my knowledge on students. And what has been a wonderful surprise is that it was actually more about learning, learning about students, learning with them. They pushed me, and I pushed them, and it's a great partnership with students. And that's Cindy and I have had a lot of fun times together. She'll tell you more about how she assisted me in a course that I taught. But I think that it's a wonderful institution. There's so many resources. I've been given so many opportunities, and teaching dental hygiene students is really I loved clinical dental hygiene, but this has been just a dream job for me. So I love working with students.
Excellent. Thank you so much. And you actually mentioned some details that we're going to get to about the different opportunities in the dental school here. So don't worry, everybody out there, we're going to come back to that in more detail. But back to Cindy. So can you share some examples of how the dental hygiene program has prepared you for a career in healthcare?
Yes. So at the very beginning of the professional phase, the biggest thing that all of the professors kind of teach the students is that you're treating the whole patient, not necessarily just their mouth. You will practice doing an intraoral versus extraoral care, which is just like making sure, like checking lymph nodes, checking their blood pressure, checking, all of that kind of stuff. Because a lot of the times when people think of dental hygienists, they just think of people who clean teeth, but in reality, dental hygienists do so much more than that. And I think it was really important that this program does instill that kind of thought in your head that you do a lot more than just clean people's teeth. You are always taking care of the patient. You're trying to find if there's any signs of like diabetes, leukemia, which all show up in the oral cavity before anywhere else in the body usually. So I think that's the biggest part of how the Forsyth School of Dental Hygiene teaches us all about healthcare.
Cindy, that was great. And I just learned something as you were giving that answer. So well done. And that's a good example of how prepared you are to go into the healthcare field. So that's awesome. And I'm also glad you mentioned the clinic. And Diane, you said this too. I can personally attest that they do actually work on real patients. I am not involved in the program besides the admissions, and I've gone and gotten dental work done there too. So it is very cool to see the students in action a few years and once they get into the program. So going back to you, Diane. So can you provide some examples of accomplishments, appointments, and accolades for faculty within the program?
Well, I could spend a lot of time, probably 20 minutes, just going down the list of what our faculty has accomplished. I can tell you that we probably have the highest percentage of full-time faculty with doctoral degrees. Dental hygiene doesn't require a doctoral degree. In fact, there's no such thing as a PhD in dental hygiene. However, our faculty have been motivated to move ourselves forward and become not just clinicians, but also researchers and people who work in outside oral health policy in the legislature. We have one of our faculty members has got a long, long list of publications. She's a published author many times. She was just appointed to the Journal of Dental Education's Review Board because of all of her expertise. And that was a wonderful feather in her cap, and it speaks to the level of dental hygiene science and research that we do. One of our faculty members was the president of the Massachusetts Dental Hygienists Association. The list goes on. And I think that because we have had those experiences, I think that our faculty serves as great role models for students of what you can do. Being a private practice clinician or a dental hygiene clinician in any form is really at the core of what we do, but that's not all that we do. And I think people don't always understand that there's many more opportunities beyond private practice. So you've got the greatest bunch of role models you could ask for at the Forsyth School of Dental Hygiene in that regard.
That was great. And thank you, Diane. It's always great to hear how credentialed and experienced our faculty is, but it's also good that you touched on it, and we're going to speak about it more, how many opportunities they are in the field that aren't just hygiene or becoming a dentist. So thank you for sharing that, Diane. So over to Cindy. So can you tell us about your activities outside of the classroom, like internships, volunteer experience, anything like that?
Outside of the classroom, I've done a lot of things, so I might be ranting on for a little bit. But the biggest thing that I did was I went on a service trip to Leh Ladakh, India, with the Global Dental Relief. I found the organization by contacting faculty within the school to help me find one, because MCPHS does offer international trips, service trips, if you're interested in them, but I missed the deadline for me. So that's why I went to go find a different organization. But while I was in Leh Ladakh, India, I got to see like the dental disparities that I heard a lot about, but I hadn't seen before. And while I was there for 2 weeks, I treated, I think, a total of almost 200 patients. There's a lot of statistics when it came with it, but I can't remember the numbers off the top of my head. But we treated about maybe 20 patients a day. So they were just in and out, in and out, in and out. And it was just a lot of fun getting to see these children who didn't really know what dental care was like. And like the only access to dental care they had was through this program. And it really opened my eyes to dental public health, which was something that I was interested in, but I wasn't entirely sure what it was. And it allowed me to start looking more into dental public health. In addition to my service trip to India, I'm also a peer mentor, which I work with Professor Smallage to help students transition into MCPHS and into the program, just so that they know what they're expecting here at MCPHS. So like during that class, we will introduce to students what the dental hygiene clinic is like. Pre-pandemic, you would get to shadow students as well and see what a day in the clinic is like, which was really nice. But again, we're in the middle of a pandemic, so unfortunately we weren't able to do that. I'm also currently working as a work study student under a research team with one of the public health professors here at MCPHS. And we also are currently working on a tobacco-free initiative here at MCPHS. And I'm also the senator for the Forsyth School of Dental Hygiene, which is under the Student Government Association. So if you're interested in learning about how to create legislation, but you're still interested in healthcare, then we still have that opportunity for you to learn and be a participant in.
That's excellent, Cindy. And Cindy is being very polite. She could go on for 20 minutes to half an hour about what she's active in outside of the classroom. So thank you for touching on a bunch of different examples there to show our viewers what is possible for students. So back to Diane. You mentioned this before, but love some more detail about, are there any additional opportunities or tracks within the dental hygiene school?
Yes, thanks, Tom. It is an unusual program in that we have more than one track, that we have that pre-dental track and we have the accelerated track, and then also a fast track in another campus. But what we just had passed through the university's academic council is a certificate program. So we have a new program. It's no more than 27 credit hours. And what it provides students that have graduated from dental hygiene is the opportunity to take those prerequisite courses for dental school that Cindy's already taken. So it's sort of, instead of doing them at the front end of the program, we've created an opportunity for students to take them at the end. Because we have had a lot of students that come into the dental hygiene program. They have no idea that they want to go on to dental school. And then they get to the end of it and they realize, no, I think I want to take that next step. So MCPHS has offered this opportunity now for those students to stay at MCPHS, complete those prerequisites, and students, I think they like to do that because they feel more at home. They're familiar with the institution. And I have to say that our students that have done this have been highly successful in dental school. And I just found out yesterday, one of our students that was a dental hygiene student just got into Tufts Dental just this past week. And so this certificate program is just an example of how students can come into the program and find their way and have other opportunities just besides getting the degree in dental hygiene that allows them to go out and practice in private practice.
Excellent. Thank you. Thank you so much. And final question for Cindy. So Cindy, is there any advice that you can offer prospective students?
The biggest piece of advice that I would give to students is I know that just before I was listing a ton of things that I was doing on campus, but I think it's important to remember to ease your way into things and make sure that you feel comfortable before you take on so many things. When I was a first year at MCPHS, I had no idea what I was doing, to be honest. When I was starting my first semester at college, as a first gen and as like an only child who didn't have anyone to look up to and ask questions, I didn't really know what I was doing, including registering for classes or like, dropping classes to change the time or something. So I didn't really join that many organizations and do that many things, or I wasn't super involved in my first year, but afterwards when I felt more comfortable, I started joining more organizations. And I think that's what's most important, that a lot of students kind of forget when they start joining clubs and stuff. They get so excited about joining so many things, but then they start to feel a little burnt out or stressed about it. And I think the biggest thing is make sure to take care of your mental health, because you're here to get an education, but you're also here to have fun, so it's important to learn how to balance all of these things.
Thank you, Cindy. I think that is very practical and great advice that everybody, even parents on here, should adhere to. So final question for Diane. So can you share some examples of student outcomes from the dental hygiene program?
Well, I want to start by saying that Cindy's very humble, and she had a lot of wisdom, and along with what she shared with you, she was very wise that she used all the resources that were available at the university. We have all kinds of supportive services for students to ensure their success while they're in the program. She wasn't afraid to reach out and ask for help in some area where she might want some support. And I think that that's one of the great things about our institution is there's lots of resources, and don't be afraid to use them. And Cindy wasn't, and that's part of the reason she's been so successful in our program. Student outcomes, there are some that are very measurable and some that and those are things like our pass rate. So our first time pass rate for the licensure exams, you have to take a written exam and you also have to take a clinical exam. Right now, that's just become on a mannequin. The pandemic kind of drove that. Now we have a mannequin clinical licensure exam. You actually get to take that before you graduate on the campus. But we've had our last mannequin exam that was done in the fall, we had a 98% success rate on that exam. We are in the 90s with the national board written exam, first time pass rate. And keep in mind that's first time. You can always go back and take it again, and we offer support to students and find ways to help them if they weren't successful the first time out. And that's not many of our students, but we do offer help to ensure that they can go on and be licensed. Then other outcomes that maybe aren't so measurable are things like what we've seen our students do when they leave us. I think our bachelor's degree, and again, those role models in the program, and we're very encouraging to students, and we say, keep going, do more, you can do this, or you can do that. So we've encouraged students to go for advanced degrees, not just dental school, but a master's degree program, and perhaps in public health. We've had some go on and get a degree in education, so they can come back and teach. We often have students that leave us, and a few years later they come back home, I like to say, and they join us on our clinical teaching team. We have, I think, about half of our clinical faculty are students that graduated in the last 5 to 10 years. So they go out, they work in public policy. They might work overseeing a program. We have one gal that moved to Delaware, and she oversees a clinic for underserved children. And there's not just clinical practice in your future once you get through the Foresight program. There's lots of different things. And we're very, very proud of our alumni and all the diverse opportunities that our students have taken. And we know it's because of their experience at Foresight that launched them into those wonderful opportunities.
Excellent. Well, thank you for sharing that, Diane. And I know for everybody out there that both Diane and Cindy could go on much longer about accolades and accomplishments here, but we want to make sure we stay on schedule. So thank you both, Professor Diane Smallage and Cindy Lee. Thank you to our crowd. I hope you found this Spotlight on the Dental Hygiene program informative and helpful. And again, my name is Thomas Egan with the Admission Office. So if you have any questions or concerns moving forward, do not hesitate to reach out to us. We would be more than happy to chat with you. So thank you so much. Have a great day.